Hi, my name is Theresa Allan and I am an endostomal therapist. This is an instructional video to demonstrate how to apply a two-piece disposable cut-to-fit ostomy appliance. The purpose of putting an appliance on an ostomy is to protect the peristomal skin, which is the skin closest to the stoma, protect the stoma itself, and to collect the stool. All pouches are odor-proof, so if you smell something, there's probably a leak. The ostomy appliance is usually changed every 3 to 5 days, or if there is a leak. It is important to change your appliance when there's a leak, as the stool coming in contact with the skin can cause skin breakdown around the stoma. Appliance changes are ideally done with baths. Your child may bathe with the ostomy appliance on or off. You always want to make sure you have all your supplies available before you start your appliance change. This will make the change less stressful and help it to be completed in a timely way. This is not a sterile procedure, therefore you can use tap water, non-oily soap such as ivory or dial bar soap. You will also need a washcloth or dry wipes, not baby wipes, as they can interfere with the adherence of the skin barrier or flange. You need a pair of scissors, a pen or pencil, measuring guide, a new ostomy appliance, and a type of paste, such as a barrier ring or strip paste. Make sure that your child is on a safe surface, as they may move around as you perform the change. If your child is older or a teenager, they may remove the bag themselves. This may be done lying down in the hospital or standing up when at home. Many teenagers will perform their own change in the bathroom in front of the mirror. The appliance is removed by applying light pressure on the skin with one hand and gently pulling the appliance from the skin with the other hand. These products are made to adhere to the skin, but also to be removed comfortably when it is time for a change. The skin may appear pink after the old appliance is removed, but this should fade. If possible, all appliance changes are done at bath time. It is okay to submerge the stoma in water. Nothing will go inside. It is good for the peristomal skin to soak in water. Wash the stoma and the peristomal skin with a non-oily soap and warm water. Rinse the stoma and the skin with warm water and pat dry with a washcloth or dry wipes. You may see small droplets of blood on your washcloth or towel when you wipe the patient's stoma. This is normal. If there is a trickling of blood oozing from the stoma, then take anything clean and dry and apply light pressure. Be sure to stop all bleeding before proceeding. Always assess the color of the stoma and the condition of the peristomal skin. If the stoma is purple or black, please seek immediate medical attention. If you notice skin breakdown, please contact your local ostomy resource. Every box of appliances contains a measurement tool. Measure the stoma using the guide. Trace a circle on the back of the skin barrier or flange. Remember that not all stomas are perfectly circular shaped. Trace the actual shape of the stoma. It does not necessarily have to be put in the center of the skin barrier or flange. Cut out the traced circle in the skin barrier flange. Remove the plastic backing from the skin barrier and set it to the side. Leave the 2 strips of paper on the backing in place. The plastic backing may be kept as a template in the box of supplies, but be sure to keep only the latest one and date it. It is important to measure the stoma at every appliance change for the first 4 to 6 weeks, as the stoma itself may change in size. Barrier rings or strip paste are different types of paste that help to increase the wear time of the ostomy appliance. Paste is caulking, not glue. If it has been recommended to use one of these products, you can either apply it directly on the cut opening of the skin barrier or on the skin close to the stoma. If placing the paste on the skin, be sure it is laying flat on the skin and not too tight around the stoma. The amount of paste will depend on the size of the child and any specific issues they are having. Generally, a neonate will only need a quarter piece of the strip paste or barrier ring, while a teenager may need the entire thing. Center the skin barrier flange opening over the stoma and press into place. Do not try and stretch it. Allow it to lie in place. It is okay to have a couple wrinkles. Remove the 2 strips of paper backing from the skin barrier flange. Attach the pouch to the skin barrier. They snap together like Tupperware using your thumb and index finger. Close the end of the pouch. Lay your hand over the ostomy appliance to help warm the products to improve adherence. If your child will lay flat for several minutes, this can also help to improve adherence. A 2-piece ostomy appliance is usually changed every 3 to 5 days, or if it leaks. It is important to have a routine change so that the skin barrier flange and paste do not melt and leave the peristomal skin exposed. It is important to change the appliance when there is a leak, as the stool coming in contact with the skin can cause skin breakdown around the stoma. Do not reinforce with tape, as this is only trapping in the stool on the skin. It is okay for the stoma to be exposed to the water in the bathtub and shower. Empty the pouch when it is about 1/3 full so it does not get too heavy and pull on the appliance. This is not a sterile procedure, therefore you can use tap water to cleanse. Do not use oily soap, baby wipes, lotions, oils, or creams anywhere near the stoma, as they may leave a residue that will interfere with the adherence of the skin barrier flange. Do not regularly use ostomy powder, barrier wipes, or sprays. These are accessory products that are only used if necessary. Assess the stoma and skin with each pouch change and notify your healthcare provider of any concerns.